I think most of us don't want to put our children in a situation where they have to be our caregiver, and that means that we need to start planning for that time now. There are some important steps that you can take now.
And joining us to tell us more is Beverly White from Peninsula Home Care. Thank you so much for joining us this afternoon.
Thank you for having me.
Planning ahead is really important because it's never too early to start that.
No, it's never too early. I think healthcare has changed. It used to be, well, I'm not sick, so why should I plan for it? I'll worry about it when the time comes. Healthcare has changed. It's far more proactive, and we need to anticipate that there may be the possibility someday that I might need some extra medical care or need to make financial provisions for that.
Okay, so how do we know when the time is coming? How do we start the process?
I believe you start just like you're planning for retirement. Even when you're younger, you think ahead, what do I want my life to be when I get a little older? What should I do now to kind of make sure that I get there when the time comes? Healthcare is the same way. We should be considering, how do I want to live my older years? What kind of medical facilities do I like? What home care agencies, what physicians I prefer, and planning accordingly. And then develop a wellness plan along the way.
In-home care is an option, right?
Yes,
so
absolutely.
If that's the case, that is something that Peninsula Home Care provides. What does that include?
Well, I think most people are more commonly familiar with custodial care when they consider that they need someone to come into the house to help with maybe meal planning, doing some housekeeping, laundry, someone to sit with you when your caregiver can't be home during the day. Your family may be out. Peninsula Home Care provides skilled care, and that is a more intensive level of care where skilled nurses, therapists come into your home and provide you with the kind of critical services that you need during your illness to recover that you may not be able to always necessarily go outside of the house to get.
Okay, let's talk money, financial. I mean, what does Medicare cover? Does it cover any of these services?
Medicare covers all of home care services. What Medicare allows us to do is to send skilled nurses, therapists, social worker, and home health aides into your home to help you recover. They will develop a plan of care with you while they're there, as well as be able to actually teach you things. Medicare allows us to have the nurse come in to monitor your symptoms, monitor your medications, teach you and your caregivers about what all is included in your illness and what's best to get better.
So I guess that's important. I mean, I think I want to stay home. I want to stay home, but I need to take into consideration what that's going to mean for me, and if somebody's going to take care of me, I got to take that into consideration too, right?
Yes,
Because
absolutely.
it can change a lot when it comes to.
Sure, because when you consider, when you get to that age, and just as Lisa had mentioned, we have to rely on our family to help us out. So we have to consider those financial implications too, how we can, if we want to stay in our home, how do I make those means happen? Medicare is a part of that, but there is a lot of other planning that goes into that process.
Okay, and now we just heard on the piece that we saw, there are legal documents that we need to have prepared. One of them is the Advanced Medical Directive, but there's also something called MOLST, M-O-L-S-T. Can you explain what it is and what's the difference between the two?
Yes, MOLST is an acronym for Medical Orders for Life-Sustaining Treatment. So people are familiar with the Advanced Medical Directive, where you get to choose a healthcare agent to make decisions for you should the time come when you're not able to make decisions for yourself. The MOLST form is between you and your physician, and what it gives you the opportunity to decide what life-sustaining measures would I want, should I be in that position. You make those decisions in advance because most people aren't able to make those decisions when that time comes. So it gives you a say in that decision. When you go into a Maryland hospital emergency room, the physician will meet with you and talk about what your options are and actually put that into a written document so that they're orders. The only way to change that is for you to go back to your physician and consider other options. The nice thing also is that document follows you between facilities and healthcare settings. So if you go to a skilled facility or to home care, those life-sustaining options that you've chosen for yourself go with you.
Now, I would like to say that everything you just said stuck in my head, but it probably didn't. But you've got a seminar coming up.
Yes, we do.
Tell me about that.
On Thursday, July the 21st at noon, we have a seminar called Aging in Process. And what we're going to do is help those individuals take a look at planning. We have financial advisors and legal advisors on hand, so you can decide maybe what living will you would choose, if you choose a power of attorney. Also, what services do you think you may need when you get older?
And that's going to be at Salisbury branch office with lunch.
Yes,
And
lunch
here's
is
the number
provided.
to register, or if you want to find out more, 410-543-7550.
Yes.
All right,
Excellent.
Beverly, thank you so much. Important
so much
information.
for
Of course,
Thank
we'll
you. It was a
have
pleasure.
all of that information and on the workshop and the seminar on our website, delmarvalife.com. Well,